We're back again with Dr. Jennifer Shuford, Texas's Chief State Epidemiologist, talking about this new surge in COVID-19 cases. East Texas has pretty low vaccination rates compared to the rest of the state. So are we seeing Delta spread faster here than in other places?
You know, we're seeing Delta spread wherever there's pockets of unvaccinated people. And so that includes areas out in East Texas, but we know that there's these pockets of unvaccinated people or people who are just partially vaccinated all over the state. So we're actually seeing transmission happen everywhere. And hospitals everywhere are feeling that pressure of more and more people getting admitted to them because this variant, just like the other ones, can cause that severe illness, hospitalization, and death. And so while we are really concerned about East Texas, it's a pattern that we're seeing, unfortunately, all across Texas.
We know how many people have been vaccinated, and you have the estimate of how many people have gotten infected. So is there that kind of range of how many people are still out there who are at high risk and how many are likely to be protected?
Yeah, it's an excellent question. And so we know that, you know, if we look at our entire state population, including those little kids in that population figure, we know that only about 43% of our state has been fully vaccinated. And so that leaves a whole lot of people that don't have that protection that vaccination offers. Now, we know that there's another proportion of people that have had natural infection or had COVID-19 and so have had natural immunity buildup. But what we know from studies is that the level of protection that natural immunity gives you or protection from a previous infection, that those antibody levels aren't quite as high as what we typically see in people who have been fully vaccinated. And it doesn't offer the same amount of protection that being fully vaccinated does, especially against these variants. And so it's important for people who have had infection in the past to go ahead and get vaccinated because that gives them that extra boost of antibodies and actually gives them super high levels of antibodies that will be effective against these variants, not only Delta, whichever variant comes next. And so even those folks need to go ahead and get vaccinated because they might not be protected now, but a vaccine can help protect them. But when we look at the people that have been vaccinated, so we're talking about maybe 43% of our population, and look at the people who have been had infection, which is probably about 35%. There's some overlap there. We think that that total number might be about 70% of our population, but we know that no vaccine is perfect, and certainly natural immunity isn't perfect. And so the number of people who are actually protected is much lower than 70%. But that would be kind of the highest part, the highest estimation.
Well, it looks like the number of new people getting vaccinated here and around the state is going up. Do you think that's in response to the surge?
Yeah, it's been good. You know, I think that Texas is having a different experience than what some other states is experiencing. We're seeing people going and getting vaccinated, you know, and who knows if it's the surge or that the messages are finally getting to them or just the availability where somewhere convenient for them. But whatever that is, we are seeing increased numbers of people going out and getting vaccinated right now, which is encouraging to us because we're so concerned with the trends in cases and hospitalizations and what we're seeing with Delta. And so really seeing that increasing number of people going and getting vaccinated or getting that full vaccination series has been encouraging to us. And so, but we're not gonna stop. We're still trying to get that message out there that vaccines are safe and they're effective even against these variants. And so it's time to go get that. We've got plenty of vaccines in the state now. So that people can go get it and can walk into pharmacies and get it and really provide that protection to themselves.
And given that it takes a couple weeks after you get the second shot, or if you get the J&J shot, before you get full immunity, is it too late for someone who hasn't been vaccinated to start now and protect themselves against the Delta variant?
It is not too late. We know that come a month from now, say when kids start school, we're going to start in the fall bringing people together into work settings and school settings, and that we're going to see circulation of this virus. And I'm hoping that some of the Delta will start to kind of burn off, But after Delta, there very well could just be the next variant that comes sweeping through. And so now is the time, the sooner the better, to go get a vaccine. It is not too late. I think that the fall and winter is still going to be a really dangerous time. And so now's the time to go get that vaccine for sure.
Dr. Shuford, thank you for being here and thank you for the information.
Yeah, no problem at all. Thanks for inviting me to be on with you.